pet, listen up. We actually got a chance to chat with the experts at VCA about what you may need to look out for your pet. So let's take a look.
Heartworms are literal worms that live in your pet's heart. They can grow up to be about 12 inches in length, and they can cause a lot of damage, as you can imagine. They are transmitted through mosquitoes, unfortunately. And living here, we have mosquitoes year-round. We get no break in the wintertime like they do on the mainland. So our pets are constantly at risk, unfortunately. The way that heartworm disease is spread, so a mosquito has to bite an infected dog. Infected dogs will have to have a male and a female worm inside of their heart. They reproduce and make microfilaria, which we'll call baby heartworms. So these mosquitoes suck up the baby heartworms. They then turn into a teenager heartworms while they're in the mosquito. This mosquito will bite a healthy dog and inject the teenager worms into the dog. Those stay in the skin for up to 6 to 7 months before they develop into adults again and then move into the heart where the cycle starts again. It can be really hard to detect it initially, so a lot of pets actually don't show signs initially until the heartworms have caused enough damage to the heart to make them sick enough. That is why it's important that we test pets once a year. Even though they seem totally healthy, they can still have heartworm disease and be positive. Some signs you first see, they can have like a mild persistent cough, they lose weight for no reason, they don't eat super well. When they start to feel worse, they may have something called exercise intolerance, where let's say your pet used to be able to go for a walk around the block and now they can kind of barely make it out the door. So all of a sudden they just seem really tired. As the disease progresses, also they can get like a really distended belly. They call it a pot-bellied appearance, where fluid starts to accumulate in the abdomen. When they have really severe signs where the heartworms are actually clogging the heart and clogging the arteries of the heart, it's called caval syndrome. And if you can imagine a pipe that's blocked, water can't get through the pipe. Same in this case, except blood isn't getting through the heart, it's not getting through the arteries. These dogs will collapse, and unfortunately most of them do pass away from this. First of all, we use an in-house heartworm test. We take a small sample of blood. We make sure that it's positive first in-house. We take another sample of blood and send it out to another lab to have a confirmation test. Because it's such a severe disease and treatment can be really severe too, we want to make sure we are accurate, that we have a true diagnosis. Once we get the secondary confirmation test, we want you to start resting your pets. So it can be really difficult. The dogs that are used to going for super long walks or hikes or going to the park and playing, that all has to stop, unfortunately, to prevent their heart from getting damaged further. Once we've known for sure they have heartworms, we've started resting them, the next step is to determine how severely they are affected. Some of them, if they are starting to be sick, we want to take chest x-rays, we want to look at their lungs, look at the size of their heart. In some situations, we'll refer you to a special doctor who can do a heart ultrasound called an echocardiogram. In some cases, if there are a lot of worms, you can actually see them in there too. Once again, heartworms live in the heart, live in the blood. The worms you see in your dog's feces, so those are usually round worms, which are curly, or they have short ones that are called tapeworms. They kind of dry up and look like rice. So those live in your pet's intestine. The difference is, they live in different places, so we test them differently. They are treated very differently, and the severity of them are very different. We're very lucky. We have heartworm prevention now. Most of the time that's either like a pill or a chewable tablet, and we give that to our pets once a month. In some cases, there's even like a topical liquid that you put on their neck, and that can also work as well. An important distinction to make is the heartworm prevention can kill the baby worms we talked about and the teenagers. It unfortunately can't kill the adult worms. So once your pet does have adult worms, usually the way we have to treat it is by injections of something called melarsamine. It's very painful and it's really expensive for pets, so it's always better to try to prevent rather than have to treat heartworms. Heartwormsociety.org, that's put on by the American Heartworm Society. They're kind of the experts. They have great pages for owners to read more about heartworm disease if they want to. And I think really the best way, you can always make an appointment with your veterinarian. It's okay if your pet is not on prevention. We just want to help. So come in, we'll get them tested and start on the prevention. Please give us a call here at VCA. You can schedule an appointment with us here at VCA Waipahu and we'll give you more information.